Hi everyone, I'm making some revision videos for you for your 5th year exam, and this is the first one. It's on rheumatoid arthritis. Rheumatoid arthritis is a multi-system disorder. We mainly think of it as affecting the joints and bursae and tendons, but it also affects the connective tissue around the body, the lungs in particular, also the skin and blood vessels, and possibly the heart. It gives progressive damage to all the organs it affects over years. Women are affected more than men by about 3 times, though the ratio for this becomes more equal as people age. Okay, I'll stop it. Together, about 1% of adults are affected. Of those, about 3/4 are women. Interestingly, it starts young, with a peak between 10 and 29 years, but it also affects postmenopausal women. So we know that rheumatoid arthritis is an immune reaction, but we don't know quite what triggers it. Possibly trauma, or maybe a microbial infection, or some other kind of environmental exposure in predisposed people will trigger a complex immune response. People with some MHC combinations will have an increased risk. We also know that there are large numbers of antigen-presenting cells and T helper cells found in the synovial pannus. We also know that activated B cells are present in the joint and they produce rheumatoid factor. And it's the rheumatoid factor that leads to the formation of immune complexes. These complexes perpetuate inflammation and destruction. This is a diagram of what rheumatoid factor might look like. It's made up of IgG, you can see the antibody here, all joined together. And whereas normally immunoglobulins react at their binding site, for example, to antigens on a microorganism, in rheumatoid arthritis, what these antigens are reacting to is the Fc part of immunoglobulin antibodies. So you can see by doing that, large immune complexes can be built up. What you see is destruction of the joints. So the classic deformities seen in rheumatoid arthritis are due to destruction of the tendons and joint capsules that stabilize the joints, leading to the classic radial deviation and at the wrist and ulnar deviation of the fingers. It all, of course, starts with swelling and stiffness, warmth and pain. Unlike in osteoarthritis, it's usually the small joints that are affected. The thing with rheumatoid arthritis, though, is that it's not just the joints that are affected. It also affects organs outside the joints, and this occurs more frequently in severe disease. So nodules are seen in the connective tissue of about 30% of people who have rheumatoid arthritis, and a further 6 to 10% have other disease that can be found, such as Sjogren's disease, anemia of chronic disease, and lung inflammation. Happening in the joints, though, that's the most important thing. Here we have synovium. This is the space in the joint. This is the synovium lining it, and it's been thrown into papillary folds because it's expanded and inflamed. You can see here inflammatory cells lying in the synovium. These have a lot of plasma cells in them, and over the top here is often a lot of fibrin. This inflammatory combination is called a pannus, and it's this that destroys the cartilage and also the tendons and the ligaments surrounding the joints, making them painful and unstable. What a rheumatoid nodule looks like: it has a central area of necrotic collagen surrounded by palisaded histiocytes and fibroblasts. You will have realized from my description that this is a granuloma. It's a granuloma that occurs around necrotic collagen. That's not the end of the story about rheumatoid arthritis, of course. These days there are many wonderful treatments that can arrest the progression of the disease and really help patients. In addition, there are more specific laboratory tests that can help diagnose it. We're very fortunate to have Rebecca Granger in our department, and she is the go-to person for any expert advice on rheumatoid arthritis diagnosis and treatment.